After 60, some changes are easy to blame on aging. But what if your body is quietly telling you something else? Unexplained fatigue. Persistent itching. Swollen ankles. Even changes in your appetite. These symptoms can have many causes, but sometimes they can be clues that your liver needs attention. Today, I'll walk you through 7 signs you shouldn't simply dismiss. Stay until number 7, because it's the one you may actually notice in the mirror. Here's why this matters. Your liver has so much reserve capacity that it can often keep working even under real strain. That's a strength, but it's also why problems can develop quietly, before anything feels obviously wrong. So here's the philosophy for today, and for every video on this channel, notice these changes. Don't try to diagnose them yourself. Let's get into it. Sign number 1, fatigue that lingers, no matter how much you rest. Fatigue has dozens of possible causes: poor sleep, low iron, thyroid changes, medication side effects, and yes, aging itself. Feeling tired sometimes is completely normal. But persistent, unexplained fatigue that doesn't improve with rest is also commonly reported among people living with liver conditions like cirrhosis. Here's where things get interesting. The next sign shows up somewhere you might not expect. Sign number 2, a noticeable drop in appetite, or losing weight without trying to. Unexplained weight loss isn't specific to liver disease, it can happen for a lot of reasons. But after 60, losing weight without trying is something worth telling your doctor about, especially alongside other changes we're covering today. Most people wouldn't connect this next one to the liver at all. Sign number 3, itching that seems to come from nowhere, no rash, no new soap, nothing that explains it. Persistent itching can be associated with certain liver and bile duct conditions. When bile isn't flowing or being processed normally, it can affect the skin. To be clear, itchy skin is common, and dry or aging skin is a far more frequent cause. But itching that's persistent and unexplained is worth mentioning to your doctor. You may actually notice this next one before you feel anything at all. Sign number 4, a dull ache or sense of fullness in the upper right part of your abdomen, roughly where your liver sits, just under your right rib cage. When liver-related discomfort occurs, it may feel like a dull ache, pressure, or fullness, often subtle enough to dismiss as something I ate. If it's new, persistent, or keeps coming back, describe exactly where it is to your doctor. That location matters. So far, most of these signs could easily be explained by something else. But the next 2 are where the pattern starts to matter more. Sign number 5, bruising more easily than you used to, or bleeding more easily or for longer than usual from a small cut. Your liver helps make proteins involved in normal blood clotting. When liver function becomes significantly affected, that process can be disrupted, which may lead to easier bruising or bleeding. Some medications, including common blood thinners, cause the exact same thing, and that's actually far more common. That's exactly why it's worth mentioning any medications you take when you bring this up with your doctor. Now we're getting into a symptom I don't want you to ignore. Sign number 6, swelling in the legs or ankles that doesn't go away, or a sense that your abdomen feels more full than usual. Persistent swelling can have many causes, including heart, kidney, medication, and circulation problems. Liver disease is one possibility, particularly when other symptoms on this list are also present. Mild swelling after a long day on your feet is common and usually harmless. What's worth attention is swelling that's persistent or doesn't improve overnight. We've covered 6 clues. But the 7th is the one you can actually see in the mirror. Sign number 7, jaundice, yellowing of the eyes or skin. This happens when a substance called bilirubin builds up in the blood faster than the liver can clear it. Bilirubin is a normal byproduct your liver usually processes, but when the liver isn't keeping up, it can build up and create that yellow tint, often noticed first in the whites of the eyes. In some liver conditions, jaundice can appear later, as the condition becomes more advanced, though the timing varies depending on the cause. So if you're not seeing yellowing, that doesn't automatically mean everything is fine. It's simply the most visible sign on this list, not the earliest. If you or someone you love ever notices this, it's worth contacting a healthcare provider promptly. Here's a dangerous assumption: if your liver had a problem, you'd know because it would hurt. That's not necessarily true. Some liver conditions can cause discomfort, but others develop with few or no symptoms, especially early on. That's why one symptom alone doesn't diagnose liver disease. What matters is persistence, combinations of symptoms, and what your doctor finds through testing. I want to be direct: none of these 7 signs, on their own, mean you have liver disease. Fatigue, itching, appetite changes, mild swelling, even occasional bruising, in most cases, these are explained by something far more ordinary. What matters more is the pattern: several changes showing up together, persisting without explanation, or gradually getting worse. Notice it. Don't diagnose it. Let your doctor help you make sense of the pattern. So what happens if you mention these symptoms to your doctor? Doctors don't diagnose liver conditions from symptoms alone. Symptoms simply tell them where to look. A typical evaluation usually includes your medical history and a physical exam, blood tests to check liver function, imaging like an ultrasound when appropriate, and sometimes additional testing depending on what those results show. This is also why it matters to mention everything you're taking: prescriptions, over-the-counter medications, and herbal supplements. Some of these can affect the liver, and your doctor needs the full picture. Beyond symptoms, it's also worth knowing that in the United States, the CDC recommends one-time hepatitis B and hepatitis C screening for all adults 18 and older, with more frequent testing for those with ongoing risk factors, even without any symptoms at all. I want to draw a clear line here. Call a doctor promptly if you notice yellowing of the eyes or skin, new or rapidly worsening swelling, confusion or major changes in thinking, or significant uncontrolled bleeding. Everything else on today's list, fatigue, itching, appetite changes, mild discomfort, is absolutely worth discussing, just not something that requires rushing to urgent care. When in doubt, it's always reasonable to call your doctor's office and ask. Here's what I want you to take away today: your liver can stay quiet even under real strain. That part is true. But that doesn't mean you're powerless. Fatigue, appetite or weight changes, itching, upper right abdominal discomfort, easy bruising, swelling, and yellowing of the eyes or skin, these 7 changes give you something valuable: the ability to notice a pattern early, and have a more informed conversation with your doctor. Notice it. Don't diagnose it. That's what healthy aging really looks like. And if you're over 60, don't stop with the liver. Your kidneys can also develop problems quietly. Watch this next video: 7 silent signs your kidney may be in trouble after 60. Don't ignore these, to learn 7 signs your kidneys may be asking for attention. This video is for educational purposes only and is not intended as medical advice. It should not replace consultation with a qualified healthcare professional. Always seek the guidance of your physician or another licensed healthcare provider before making changes to your diet, medications, exercise routine, or healthcare plan. Thanks for spending this time with me. Take care of yourself, and I'll see you in the next video.